John, were the 262 days of your life lost to COVID through lockdowns worth it?
No. No. This is, again, something else that hasn't been discussed. As the health professionals, as the politicians, as the media cheered the lockdowns, there was no discussion of the costs. To talk about the costs was to be seen to be irresponsible. We now have not just an economic cost. We have a cost in lives lost, literally. We have a cost in years of education lost. We have a mental health crisis in Victoria and in many other parts of the country. And we were locked down for reasons that were quite different from what actually happened. We were told we had to be locked down to, remember, Nick, flatten the curve. Then we were told we had to be locked down to eliminate COVID. That didn't happen. I'm going to argue the Australian public were not just misinformed, we were misled. I'm going to use a stronger term. I think we were deceived. I think there has not been an accounting or a reckoning of any of this. And as you said earlier, if ever this is going to be reviewed, it shouldn't necessarily be about punishment, but it should be about recognising the damage that has been done. And I would argue it's about some people acknowledging failure, fault and shame for what has occurred.
One thing we kept asking at the Menzies Research Centre is, what are you trying to achieve? Where are you trying to get to? And, you know, sometimes they say flatten the curve, sometimes they say we want to stop people dying unnecessarily. All right, fair enough. Whatever it was, Premier Daniel Andrews said at the end of your sixth and final lockdown, Victorians can be proud of what they've achieved. What exactly did they achieve, however? Let me show you the latest health certificates. Despite imposing the strictest lockdowns in the world outside of communist China, as far as I can see, more Victorians have died of COVID-19 per head of population than in any other state. 751 deaths per million in Victoria, 559 in New South Wales, 419 in South Australia, the third most deadly state. Look, correlation isn't causation, John, as we keep telling ourselves in research centres, but it looks like on those figures that lockdowns had little benefit overall and caused, as you say, a lot of pain.
Well, that's right, Nick, and we've got exactly the same sort of data from overseas, especially from the United States, where you can compare state by state, mask mandates and lockdowns imposed in some states and not imposed in others, and you can compare the data. But it's, as you said, what is concerning is that there's been no accounting for this. There's been no reckoning of this. The cheerleaders of the Andrew government, the cheerleaders of these draconian policies, are now not going to ask what has been achieved, because what has been achieved are the figures that you have just read out. And that's why it's going to be difficult to accomplish some sort of reckoning for what has occurred, because too many people, too many organisations are complicit in what has occurred.